You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. He's been on the program before, close to 7 or 8 years ago, and he is focused his practice on dental implants. So he's an expert on the topic, Dr. Stephen McAnaney. Dr. McAnaney, welcome to the program. Welcome back.
I'm glad to be here, Randy. It's great. I just wanted to tell you something before we get started this time, because this is the third time here, and over all those years, this show has been very, very important in allowing people to find out what's available out there and what's possible, and it's changed many, many people's lives in the positive way forever and ever.
Now, before the camera started rolling, you said that some people see it on, or one person in particular saw it on a Sunday and thought it was like some divine intervention that she stumbled onto you. Is that right?
Yeah, exactly. One particular lady, this one we were talking about, woke up on an early Sunday morning. She was having trouble sleeping, and she turned on the TV, and lo and behold, the show was on. Yeah. And what she saw in that show was the answer to the problem she was having, and she saw an option or an opportunity to get out of the misery she was living in. So this is a lady that was sitting there that could not eat. Her teeth were really messed up, and she was headed towards dentures, whatever. She'd been other places, and they had given her no hope whatsoever. So this Sunday morning, she sees the program. It gives her a little bit of a spark, and so she calls and comes in. And now she's brand new. She got her new teeth, and it all happened very quickly. And then we had the surgery day, and then she wakes up the next day and has this beautiful smile she's been wanting for a long time. So who knows? Maybe it was a little bit of divine intervention. I don't know.
Who's coming in these days for dental implants? Like, who's the typical patient that you see?
Well, let me tell you, there's two big ones. There's the ones that their teeth are cracked and broken, have gum disease, have other health issues or something like that. It's just a mess. And you have others that have no teeth, that have dentures forever, that are miserable with them.
Okay. Now, these denture wearers, is it hard to get them in? Because you say they adapt, meaning they just adapt to their denture.
Yes, the denture wearers have had dentures for a long time in most cases. Those are the hard ones because they've been through all the treachery of old dentistry where they just had everything in the world done, spent thousands and thousands of dollars. Now they have the dentures and they feel safe. It's only to the point when they don't work anymore. Oftentimes people have just gotten dentures and they hate them because they don't stay still. All the things, dentures just don't work. We've known that forever.
So you get a lot of denture wearers in your practice?
We do get a lot of denture wearers that are just sick and tired. The nice thing about right now out there is people realizing there's other options. They're also starting to realize that the longer they have dentures, the worse it gets. It never gets better. Their bone goes away. People are living a lot longer. Their desires are changing. They realize they want to eat better. They want to eat more of the things they want to eat. They're just sick and tired of being sick and tired with those dentures and that glue they have to put in. Nobody likes that stuff. I don't know why they even have it on the advertisements. I mean, could you imagine having glue, that big, have you ever seen this stuff?
I have.
It's like wallpaper paste or something like that. And just to have that in your mouth and like, ugh.
I had a doctor come on the show and made me put it in my hands. You literally have to leave and wash your hands to get it off. It's very gooey. So they don't like that stuff.
No, they don't like that stuff.
So that's gone. That's behind them.
That's gone. So now they have teeth that really work. They work as close to real teeth like they used to have, that they don't really remember they used to have because they've gotten so used to not having them. They've adapted. So they don't have a clue about it. Now let me tell you something that's kind of neat. This is great for women specifically, well, for their husbands too. So I'll start talking about some of the things they don't like. Well, they move around. They won't stay still.
We're talking about denture wearers.
Denture wearers, yeah, denture wearers. And they have glue. They don't like glue. But then we start talking about taste. So have you ever done this little trick or a little experiment? Why don't you fix one of the best dishes you like that's nice and flavorful and eat it with your teeth in, and then stop, wash your mouth, take your teeth out and eat it. Tell me if you cannot taste the difference.
Oh, interesting.
And they can. They said, oh, wow, yeah.
Because the roof of the mouth
the roof of the mouth, because your smell plays a huge, like 80% of the role in your taste. People don't know. But once they discover it, they're like, oh, well, you have something. So the ladies, I say,
nice.
Do you like to cook? And they said, oh, yeah, I love to cook. I said, do you ever think that possibly what you're cooking is way over salted and over seasoned because you're tasting it? Oh. But the other people have to eat it. And they say, oh, my gosh. I don't know. That would be a bad thing. So I asked the husband, I say, does the food always come out over seasoned or too salty when your wife cooks it because she has dentures? He says, well, yeah, I didn't realize it. Maybe that's why.
Because they can't taste their
Can't
food as
taste
well.
it.
So that goes away. So when you give them their new set of teeth, the roof of their mouth isn't covered,
It's not covered.
and now their taste comes alive.
Exactly. Taste comes alive. So a bunch of things happen. They stay put. So here's one thing, that with the teeth that stay still, they don't move, so it helps form your face. It makes them look younger.
Okay.
Okay, it reforms that face. You know, your face will stretch. Even if you're pretty old and your face has got wrinkly, it makes those wrinkles come out.
Okay.
Over a little bit of time. The other part is you can eat all the things you really have missed eating that you forgot that you missed eating. So you can eat nuts and raw vegetables and salads and crackers and chips and crispy things and corn on the cob, all that stuff that we like to eat.
Is this one of those things where they say, I wish I would have done this a long time ago?
They always do. I wish they'd been here. I wished I'd have known. I mean, it wasn't like this a long time ago. I mean, I've been doing this 27 years, and we used to do it all the old way. I mean, it was very long. You'd have to put that, well, we didn't have implants, and then we did. And then we'd have to put them in and wait. It's a big, long procedure to have to do.
But you say it's still being done that way.
It is still being done. It's really unfortunate because I don't know why. Maybe they just don't want to do it, or they haven't learned how to do it.
It's training, right?
Training.
Comes down to training of the
Lots
dentist.
yeah. And so nowadays we can do it in very short, just a few visits, and literally transform. They come in the office that morning, and they come back. They walk out with their new teeth attached to their bone. I mean, it's in there like real teeth. They come back the next day, they're like a new person. What's amazing about this procedure, and it still blows my mind to this day.
Okay.
Every single time, and you'd think I'd know after hundreds of these, the very next day, it's incredible. The amount of discomfort is so minimal, if any.
Okay.
No swelling, and it's just amazing to know what they just had done.
I mean, everybody obviously heals differently.
They do.
But some people just, it's easy for them. Is that right?
Provided the old way. This new way of getting instant teeth in your mouth in one day is a lot less traumatic and they can start eating and functioning almost immediately.
Now, when they see themselves in the mirror for the first time, you say it's a big, big deal.
It's a big deal. Matter of fact, you got to be careful because I may cry right here. I'm not kidding you. But we all get emotional. Me and my teammates, my assistants, we sit there. They cry. We cry. Their husband, wife, significant other, they cry. It's just a big emotional thing. Even the anesthesiologist cries. They don't even know the people. They just come in to do that, right?
Good.
It's a big deal, and it's so exciting. And you can see how excited I have to hold back because when people come into my office, for instance, and they've seen the program, or maybe they've heard from somebody that had it done. Whatever the case, they come in. When I see them on the schedule, because we mark, they saw wellness hour, they wanted this. We get excited. We have a little huddle every morning. Can I get ready? And we all get excited about these. We get excited about all of our new patients, but we really get excited about these because we know from experience what we're going to get to do for this person. Because they come in, they tell me these crazy stories. I mean,
like the sad hard luck stories.
Oh my gosh! I mean, just terrible treachery stories about everything, about this, everything that's not going right.
But you say you get excited sometimes while they're talking and telling you this.
Because you know what? Well, let me tell you what I oftentimes tell them if they'll let me. I'll just say, you know, Nancy, I know how you feel, and I'm really sorry you feel that way. But let me tell you something. I see a beautiful person inside. And I know what's going to come out when you get this done. Because it happens every time. I have not been wrong. I mean, there's a wonderful person inside this prison that's been held back by their mouth, and they can't understand it. Matter of fact, oftentimes they can't comprehend what's getting ready to happen to them after they get there.
Like you know it. Like you could see how good this is going to be.
Yeah, I'm their visionary kind because I've seen it.
It's just teeth.
It's just teeth, right?
It's more than that, you say.
Just think about it. In today's society, how tall, how wide, how big, what color you are, doesn't matter. I mean, this is what matters. It's right here.
We're going to take a quick break. We come back, we're going to get to some of those photos, as many as we can.
Okay.
But I want you to take me through the process, what they can expect on day one, and the steps of the implant process. You're watching the Wellness Hour, news that makes you healthier. We'll be right back.
My name is Jeff Epley. I'm an investigator with the Choctaw County Sheriff's Office in southeastern Oklahoma. I'm fixing to get married. You know, it's one of the things I want to be able to do is show off a smile and be happy and actually smile during my wedding.
They look amazing, so I catch myself smiling a whole lot more. Now it's great, you know, I'm able to smile, I'm able to talk to people. It's just all around life-changing. Absolutely recommend it. It's phenomenal.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants, and Dr. McAnaney says nobody should be wearing a loose-fitting denture. Dr. McAnaney, welcome back.
I'm glad to be back.
So this is kind of like a big thing in dentistry now. Like it's changing everything.
It is changing everything. Now, here again, I mentioned a while ago, I've done it for a long time, mainly because I've seen the transition of dentistry. So all those things we used to do, we always knew dentures didn't work. We just did everything we had to do to try to get that tooth to last one more day until it fell out. So how silly was that?
Okay.
Now we can bypass all that. You know, it's kind of like playing Monopoly. You get the go button or whatever it is. You just go past all that and go back and get started.
Okay.
And so it's changing because in just a few visits, like the patient comes in, they see the wellness hour, whatever. They come in, we visit, they tell me their hard story, and then we show them what's possible.
Okay.
And then they get excited. Then they get a few measurements, they come in. So like 2 or 3 visits, they're ready to go. They come into the office, anesthesiologist makes them comfortable. We get the procedure done and they wake up 4 or 5 hours later and they have their new smile.
Is that right?
And I mean,
How soon can they eat?
Immediately, the next day.
But they have to be careful.
They do have a limited diet, but they can eat anything they want to eat for the most part.
Okay, good, good. Now you brought photos. What are we looking at?
Well, this first one is amazing.
Okay.
All of them are amazing, matter of fact. I wish I could have brought all the hundreds I have because they're all amazing. And I wish I could bring a story that they all have to tell, but there's not enough time, right?
All right.
So this man right here,
All right.
he's ex-military recently, did a lot of great things for our country. He comes in and he's ready to start a civilian life. Start getting a job, working, being successful, and everything else that goes with it. But his smile is messed up. He's very, very self-conscious about it. He comes and tells me, it's like, you know, I've been looking at your program. I'm looking for an answer. I just don't feel good. I don't look good. I know I look terrible, and I want out of this situation. Because after all, I want to get out there and experience getting, you know, working, getting a job, getting better. He understood it.
Okay.
Matter of fact, a lot of these people in this younger age group understand it's so important that you look better because you don't, unfortunately, have a chance oftentimes. It's not fair, but it is.
Okay.
His options were a denture, which absolutely was not an option for him. I mean, look at his age group. No way a denture. That wasn't going to work. And the other option was to have the teeth in a day or the instant teeth, where he comes in and we transform him into as close to real teeth as possible.
Okay.
So he walks in for surgery day with his bad smile, and at the end of the day, he wakes up and he has his new smile. Now, when he wakes
He
up,
looks pretty happy there, by the way.
now that's the very next day, the next morning.
Okay.
I mean, he had all this done and had those put in. He comes in, he is so excited. Now it looks like he might just be putting on, but let me tell you what, I've never seen. I mean, he's like just kicking and just having so much fun. And all my team, all the girls that worked with me on this are so excited for him because he really turned into a really great guy. See, this is what I'm talking about. There's a good guy in there. And he's a great guy,
That's a good
even
point.
before, but he just didn't look the part.
So
And
he never smiled before because of that?
Yeah,
Or
plus-
rarely?
all that goodness inside couldn't come out because he knew what he looked like. It's a mental thing that goes on when you change somebody.
What's that over there?
This is him with 2 of my great assistants, and he's really excited here. He wanted to hold, he got to pick, and he picked that one.
Okay.
That he wanted to hold up.
Good looking set of
Yeah.
teeth. You know, it really has, because you say it changes their appearance, but when you look at the before and after, it does change the appearance. I mean, he looks more handsome, more credible, more trustworthy. All the
Yeah.
things you talk about. 'Cause
Healthy.
I always think you're exaggerating. I
No.
think it's obvious here.
Here again, it's what we see. I tell my patients, it's like, the way you look is what people see. That's pretty profound in a way, that's real.
Yeah, okay.
And so you have to determine what you want people seeing. And so many of these people, like I said, they come in with these stories. I get to hear stories that are really saddening. It is. People that won't get out of their house, people won't go do this, won't go hang out with their friends, won't hang out with their girls groups or ladies groups or all these things. They don't go because they're embarrassed because they couldn't eat. They're worried about eating or
And
smiling.
that all changes?
It changes. Can I say one thing that I believe? I don't just believe, I know to be true. This process is more profound and powerful than any other thing you can do to change your life that quick.
Okay. Well, that's good that you believe that.
Because
You've seen it firsthand.
I see it. I mean, weight loss takes time. Getting in the gym, getting in shape takes time. Some other types of plastic
But this
surgery
is
takes
instant.
time. Instant. I mean, you come in. I know it seems too good to be true, but I've seen this happen hundreds and hundreds of times. When I first started doing this, it just happened. But now I'm so excited about it. I mean, I'm trying to hold it down, but I get excited
Okay,
because
okay.
it's great. It's the best thing. Somebody comes in. This is a life life-changing, game-changing move.
For the sake of time, I hate to interrupt, but I got to get to those photos.
Okay,
so what else are we looking at?
So here's another one. This lady comes in with a similar story of all the other ones. She's not happy about her smile. I mean, her teeth are dark, they're broken, there's spaces. There's a multitude of problems going on there. So she didn't really have any other choice but a denture. I mean, maybe some finagle type of dental plan, but it wasn't going to make sense. And so she decided to get the teeth, instant teeth, or teeth in a day.
Okay.
And now you can see the difference. I mean, she looks happier, she looks younger, she looks more sophisticated, she looks more confident, which I know that's the case because you hear their story afterwards. Now, the neat thing about the story is they're excited the day afterwards. But a week or two later, now here's where the stories come in, is 6 months later, a year later. We get to see them transform. It's almost like, I never had kids. People think that's crazy, but I didn't. But I get to see these people develop in life at their point in life to the future. It's almost like if I was raising a kid,
Nice.
I don't know if that sounds crazy or what, but I get to see them develop.
So they come back in for their cleanings and things like that,
but they
and you
change.
see them develop.
Yeah, clothing, hair, relationships, jobs, promotions, everything. I mean, their life just changes like they were hoping it might change.
If they let it.
If they let it.
Okay.
Or sometimes it's beyond their belief. It's almost too much at first because it changes so quick and so positively. So look at the after. I want you to look at her teeth, how they fill her mouth, and they're so perfect. There's not too much tooth, not too little amount of tooth, and it really gives her a mouth of fullness, makes her look so much better. And that's by design, that's not by accident.
To make these things look real.
Yeah, we custom make every single person. Now, let me tell you real quick about this.
Okay.
The teeth design depends on a person's age, gender, their height, their ethnic background, etc. So we just don't have one for everybody. It's very specific of the style and type of tooth. The patient gets to pick the color of the teeth. That's it. Everything else is designed by not only myself, but the custom place that does it.
Because these look real. I mean, these all look great.
Yeah, it's down to science. It's a science.
It's their teeth. I mean, do they feel like it's their teeth?
Yes, or better than.
Okay.
I mean, they're always better than.
So they brush them and they come in for cleaning
Brush
just
them,
like a regular.
Yeah, come in for maintenance. They're just there. I mean, they're there. Can't have a cavity. They don't hurt. No toothaches. No cold or hot sensitivity. No gut. All those things have gone away.
Most of these are not snap in, snap out teeth. These are permanent teeth that don't come out.
These are the permanent ones that don't come out. Now, we do a lot of the snap-in ones. Most people come in wanting the teeth that are as much like real teeth that don't come out. Now, in reality, everybody comes in, maybe they can't get those. We always have a solution for everybody. They always get something, even if it's the snap-in teeth. Okay. It's not like it's a second-rate thing. It's good. It's not as real as the
So
other
it's a more
ones.
affordable option.
It's a more affordable option.
They can always graduate to a fixed set of teeth? Okay.
Yes. And we always tell people, hey, whatever happens, it's going to be better than what you're doing now.
Okay.
So let me show you another one. This
right.
guy's great. He comes in. He's a sheriff's deputy there in Oklahoma, and he was getting ready to get married.
Okay.
Great story. Beautiful wife. He's a good-looking guy, but his teeth, his wife, they both came, said, we got to do something here because wedding's coming up. Get this, 2 months. They gave me 2 months, really? This always happens because something's coming up, especially now in wedding season. I'll be getting this stuff. Hey, I got to have it fixed, and it's got to be quick. And I said, I just have the answer for you. Teeth in a day. Okay. We can get this done. We can pull it off. I can pull some strings. Let's get started today or tomorrow. And sure enough, he comes in. So we had those in literally a week before his wedding. And he wasn't swelled, he looked fine, he was ready to go, and his wedding pictures are beautiful. I wish I had them to show you. And his wife is very happy. Great couple.
Nice.
So here's another one. Now this lady's very great. She'd been contemplating this for a long time. Her smile, she had an accident years ago, very cool. And look at her smile. I mean, it looks so natural compared.
So in that before, she would have had to have dentures.
To fix that? Yeah, because her teeth had too many problems. Yeah, they were lots of problems. Foundation problems, decay, cracks, all the stuff. And she got the teeth, the instant teeth. Now, interesting enough, her sister just had it done too. So that's a sister story. She just had it done a few months ago, and they're both happy. They did a little video about it. They were just having a great time. We'll show another one. Now, this one's really, really incredible, like the other ones, but look at that. I mean, she's turned into a new person. Look at her smile. It's so nice and big, and it's so natural looking. It really fills her face out.
She looks younger.
Yeah, the before picture, we were having to make her, look, if you don't smile, we're going to tickle you or something, because she just wouldn't do it. Because you know what? These people don't smile.
Okay.
You don't know they're this because they hide it all the time. Guys hide it with beard and facial hair. Women just, they're tight-lipped like so. But she couldn't she couldn't stop smiling the day after. So that's what happened here. Really great story. She's very happy, and you can see it made her just more presentable, made her look more confident. It does, they not make them, they are more confident. It triggers the inner self.
So the charisma comes up.
It comes out. What's been in here because they've been of this. This is like a little door that they can't figure out how to open to get out of.
Okay.
And then when they get it, it opens up a lifelong of change that's forever. Okay, here's another one. Now this guy, he comes in, you might think, boy, he was a tough looking guy, and but
That's got to be unusual.
But it's not unusual. You know why? Because people, you never see that one.
They never smile.
They look mad all the time.
Okay.
And you know what? Here's a guy, he wanted a pretty smile. I mean, my goodness. So anybody can have a good smile, and look at him. He just looks like a brand new person.
Nice.
I mean,
So this guy would have also been in dentures.
Oh, guaranteed.
Are the guys coming in because they're in pain? They just can't eat and chew? Is that normal?
That drives them, or their wife, or whoever gets them in there.
Drags them in.
Yeah, because
you say they even the wife makes the appointment
for
the husband sometimes.
A lot, yeah.
Really?
They're too macho. They don't want to admit it, but they're suffering in pain and they're being grumpy. Whatever. Now, when they get this done, then they discover this new.
What does this guy say? I mean, because he doesn't even look like the same guy.
He has a lot to say. As a matter of fact, I had a picture currently. I mean, he's changed quite a bit, but he's just so excited. And when people come in like this, I'm like, okay, this is interesting. I mean, you start thinking about why do they want to do this anyway, and they tell you the same stories. They want to be better.
How old can you be to do this?
You can be as old as you want to be, as long as
like what's your oldest patient that got new teeth?
95.
90. Why would a 95-year-old want to do this?
Because they want to, believe it or not, they want to be able to eat and chew. They understand the health, but you know what? They still want to look good.
Okay.
It's amazing. Okay, so this one here, let's just take a look. This is something for people to realize. People come in oftentimes and they're starting to get spacing in their teeth, and they haven't always had the spacing
like
there.
The teeth are
and they don't know
what's
why.
What's going on there?
Well, here's what's happening. They're losing support, so the teeth are moving. Your teeth aren't supposed to move by themselves, right? Without braces or something. So they start to move, they migrate because of gum disease or some infection, something going on there.
So that's a bad sign.
That's a bad sign.
If you're starting to get spaces where you didn't have them before.
Or your teeth get loose.
Okay.
No good. I mean, that's not normal. You just don't supposed to bleed either.
So what were her options?
Her options were denture. That was it. There was no fixing that because the foundation, there's lots of problems. So we did the instant teeth in a day. And then she got out of that. She feels better physically, and she feels better mentally. And so
this is a big difference.
A huge difference.
Looks great.
And this is what I'm talking about. New hair, new look. Just they're like they're sisters or something. They're not really, but it's the same person, the new person.
Yeah, that's.
And then the stories that you could hear and hear and hear that these people have to tell you are great. Their experiences in life change. That's the thing. They change. So here's one more.
All right.
This is another huge change. You can see in the beginning.
Wow.
I promise you, she wasn't smiling ever, unless she did it without knowing it. She was very embarrassed. She has a job, a good job in a company where she has to be interactive with people, and she was just very embarrassed. It's just the same story over and over. So her options were not. Man, there was decay everywhere. There's no way to fix these teeth. It had to be dentures. That was the only way to get it straight, looking good, get the disease out, all that. That's traditional, that's bad. We did teeth in a day, and now she looks beautiful. Here again, a custom-made smile that fits her face. It makes her look very natural and makes it really pop.
She's got to be thrilled with that.
Yeah, it comes out. So can I do one more?
Yes, time for one more.
Now this is a really great one.
Okay.
Now here we have a really lovely lady. She's a top seller with a real estate company, and here again, her teeth are messed up, and they don't look so bad in the first picture. There's a lot of underlying things, and she knows it. And the thing is that because she knows it, she can't be herself. It
bothers her.
It bothers her. So when it bothers you inside, it comes out on the outside. That's what happens. I see it all the time. So she determined. Now this is interesting because she maybe could have fixed her teeth, but it didn't make financial sense. Now, we have people like this in my age group, her age group, that think, hey, I've spent enough, I've been through this, I'm tired of getting my teeth fixed, I'm tired of spending money on it. I want to get something that's going to work, be good, look good, eat what I want to eat, and be done with it for maybe ever. I don't know.
Okay.
So she gets she comes in, and she gets the teeth in one day, and then she leaves just like this with her new teeth. Now, you can notice This is the very next day
Yeah.
or so, yeah. And so she's smiling, but she's not cheesing it. She's just not used to it yet.
She's not smiling big.
But
yet.
I'm telling you what, if you were there, if she could speak right now, she's instantly more confident. And I know it's impacting and helping her ability to show and sell houses, and that's what she does for a living.
You say over time, after they get some compliments and things like that with their teeth, then they start smiling big all over town.
Yeah, they get compliments. They learn how to use it. Just think about just learning how to smile and enjoy life when you didn't. And you don't know how to do that yet because you don't have the responses. So once you kind of get out of your shell and you realize that people are enjoying being around you, and maybe they give you some good compliments, then you get excited and you want to show it to everybody.
Good, good. Now we're out of time, but we should also mention, you have financing available even for people that don't have good credit. You say, if you have a photo ID, you can get them approved with 30% down. You also have other outside lenders that'll finance people as well. Are people financing this?
A lot of people finance it all the time.
Medicare and Medicaid don't cover this.
Or dental insurance. I mean, it's just minimal. So the outside help from any sort of benefit insurance possibility is so minimal, if any. So financing is always, it's just like buying anything else. It's an investment, so you get financing. Okay. And this new one that you're talking about has been a real hit, but we have all the other ones. We have all sorts of ways to help you pay for it if you need that.
Final message, and we're out of time. Somebody watching this, they've heard you. Maybe they've seen you on TV for a long time. And for whatever reason, they're still afraid or they don't want to invest in themselves. What do you say to them? What
I would say to the people out there that are still wondering about this, just give us a call. I've done so many of these. I can show you. We'll take you through the steps.
Just get some options.
Yeah, and we
we'll
have
meet with you.
Now, the good thing is we've done it so long, we have a system. I mean, we have learned and we have a system that works that every single time, and we can get some options. Maybe that's not, but do something. Just at least come meet us. We can show you some more pictures. Matter of fact, a lot of my patients that have had this done are willing to talk to you. They're willing because they want to help the next person that wants to do this. So maybe you could talk to one of them.
It's a free consultation, right?
Free consultation.
Okay. They just come in. See you?
Okay, see me every time.
You're too much of a big shot now because you're all over TV.
No, one of the things that makes people nervous, I like to talk to them too long because it's really important for me to understand what they're wanting. It's my greatest desire.
Does your office complain about you that you talk too much with the patients?
Sometimes, but it doesn't matter. My biggest deal is I want to be sure that I do my best effort to help somebody make that transition to the other side.
Okay, good.
So that their life will be different.
Very nice.
That's what I do, and that's why I come to work every day.
Thanks for coming on the program again. Great stuff. Great stuff. And all these photos are on your website. They can make an appointment there.
Yeah, well, there's plenty.
Okay.
And videos.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.